5 ways to keep your bladder healthy and happy. These practical, everyday tips will improve your bladder health and help you avoid urologic conditions like incontinence and UTIs. Your bladder, a hollow organ that holds urine from your kidneys, is one of those body parts that you probably don't think about until it stops working properly. Certain problems affecting your bladder can cause painful urination or urine leakage at unwanted times. These simple lifestyle changes and exercises can help ensure that your bladder keeps doing its job and doesn't call attention to itself. 1. Urinate completely to avoid urinary tract infections. Women are especially prone to urinary tract infections, which can also involve the bladder. One way to reduce your risk is to make sure that you urinate completely, says Gopal Badlani, Maryland, of the Wake Forest University Baptist Medical Center in Winston-Salem, North Carolina, and a specialist in bladder issues. If you tighten your muscles to stop urinating too soon, the urine that didn't quite escape will head back to your bladder, which can bring bacteria into your system. 1. Drink plenty of fluids to flush out bacteria, but don't overdo it. Drinking plenty of water, 6 to 8 glasses daily, can flush bacteria out of your urinary tract and help prevent bladder infections. But many people drink more than that these days, having heard that drinking water frequently is healthy, Dr. Badlani says. If you're bothered by a constant need to empty your bladder and you're drinking fluids throughout the day, cut back on your intake. Also, avoid caffeinated sodas and coffee. They'll only make you urinate more. 1. Walk regularly to avoid retaining fluids. Some people, like those who are sedentary or have heart disease, may develop fluid buildup in their legs during the day. At night, this fluid causes them to need to empty their bladders frequently. If you have fluid retention in your legs that's causing an active bladder overnight, try walking around more throughout the day. If you can't walk, flex your calf muscles and raise your legs to waist level. 1. Avoid tobacco to help prevent bladder cancer. Every year, more than 50,000 people are diagnosed with bladder cancer, according to Johns Hopkins Medicine. Tobacco use is a major risk factor, Badlani warns. Smokers are at least 3 times as likely to get bladder cancer as non-smokers. If you're still smoking or using other forms of tobacco, it's important to stop for bladder health and other reasons as well. Talk to your doctor about how to quit smoking. 1. Learn how to do Kegel exercises to prevent urinary incontinence. Kegel exercises are done to strengthen the muscles that allow for better bladder control. Weak muscles can contribute to urine leakage, called urinary incontinence. But most people do Kegels the wrong way, Badlani says. If you're having bladder control issues, talk to your doctor or a specialist who can teach you how to properly do these exercises.